Are there plans to ensure that this time around we have enough monies to ensure that we can contain this epidemic if it reaches, God forbid, to the situation we had back in 2020?
Just to point out that at the counties, we have the acts. Through the county assembly, they've been able, each county has their own act that guide them as far as the emergencies are concerned. The issue is not even so much in terms of having the funds available, because the funds are available, and that's as per guided by the act, that is in place. The challenge that we have, and I need to call a spade, the problem that we have is on the execution, is on the utilization of these particular funds. At times they're not used for what they need to be used for, and that's where the problem is. But in terms of the question of, are we prepared, have we set, have funds been set? They have been set because the law requires that to be set. That is in place, that is okay. The only challenge at times you find is now the personnel that have been given the mandate to be able to ensure that they execute the functions of an emergency fund. Remember, in the Act, as per the counties, we have the board. You know, we have also the committees that have been set within that particular emergency fund, and one of the requirements is what you just call the basic public participation, for them to conduct and get to verify, get to know how many people have been affected, what are the basic needs that are needed depending on the different pandemic issue, because different pandemic issues then require different solutions at different times. So public participation takes place to determine the different factors, of course with the help of experts, you know, and during these times I really want to appreciate Red Cross. They've really come so much aboard during emergency times and been able to offer their services, their expertise, and we've been able to have solutions. But the biggest challenge at times is the people who have been given the mandate to be able to ensure people get the help that they need at that particular time with the funds that have been set. If it's procurement issues, they need to be adhered to, and what needs to be bought should be able to benefit these particular people who have been genuinely affected by some of these issues.